everyone, and welcome to Nurture Hub Member in the Spotlight interview. Today I'm very blessed to have with me Dr. Lucinda Smith, who's a perinatal psychiatrist at the Glow Perinatal Emotional Health and Wellbeing Clinic, which is located in Melbourne, in Berwick to be specific. So welcome, Lucinda. Thank you so much for joining me.
Thank you, Shari. Very lovely to be invited.
Oh, well, I really think that what you offer is such a beautiful service and support to women. So I'd love to actually, first of all, ask you, what is the Glow Clinic about? What kind of services do you provide, and how do you help women and families?
Sure. So Glow Clinic is a relatively new clinic in the big scheme of things. We have only been open since about February 2016. So we, in fact, consider ourselves just to be toddlers. We've just been around for a bit more than 12 months. But Glow is a little bit of a unique offering when it comes to looking after mums and bubs and families around the time of pregnancy. We have tried to create a clinic that is a little bit of a one-stop shop for mums, bubs and their families to really look after their emotional health needs, but also some of their physical health and early parenting needs. So maybe to make that a little bit clearer, what we've done is bring a number of different practitioners and clinicians into the one building so that we can help look after families really from the moment they even consider getting pregnant. So talking about the preconception phase, all the way through pregnancy, through the first year of life, which is where the perinatal period is often thought to finish at 12 months. But at Glow, we realise that a lot of the problems families face, they don't stop when a child turns one. You know, the challenges can continue. So Glow stays involved until children go to primary school, and some of our services will even stay involved throughout primary school.
Wow.
And when I talk about our services, because we're trying to focus on optimising emotional health, mental health and general wellbeing, we bring together a range of services that can address emotional and mental health. So we've got psychiatrists and psychologists. We've got a male psychologist to specifically help address dad's needs. We have a couples counsellor to help couples adjust to the challenges of parenting. We've then got what we call our developmental paediatric team. So we've got a paediatrician, an infant and child psychologist who can particularly help with issues around parent and infant or parent and child relationship difficulties. And we have our wellness services, which is all about promoting general health and wellness, and that includes a women's health physio, a dietitian, yoga classes, Pilates, and then our final spoke is probably sort of our early parenting support service, and that includes having a lactation consultant and access to sleep settling support.
Wow.
So lots of things.
Just a few services. That's amazing. And it's so great you're in the one spot. And to be able to hear that you can help families even preconception right through to then their children growing up into primary school, that's amazing. I've never actually heard or know of any other place yet that provides that. So congratulations, that's amazing.
Thank you. And I think, right, as far as we know, we're the only one, definitely in Victoria and possibly in Australia, to have all of those different services and have that extended time frame that we stay involved.
Yeah, beautiful. Beautiful.
I have to say, if I can, just before I go any further, is that I certainly can't take all the credit myself, because Glow has been launched by myself and my colleague, another perinatal psychiatrist, Dr. Adobe Udachuku. So we've launched it together. And a lot of the thinking came from the fact that we've both worked around Berwick for a number of years with mums and bubs, and just realised that all of the services around there were very fragmented and very difficult for parents to access, particularly when they might be feeling a bit stressed or vulnerable. And we just wanted to make it easy for people to get what they need in one spot.
Definitely. I mean, as a parent myself, I have 2 beautiful children. They're 5 or nearly 6 and 3 now, but it definitely is such a huge transition from, being, I guess, just my husband and I as a couple to, bringing these children into the world. And I definitely, even with the experience that I had with my birth, I had a beautiful birth because I'm a Hypnobirthing Australia practitioner, but I did find it really challenging then thereafterwards with my own emotions up and down, and even the relationship with my husband and I, you'd have good times and then there'd be really hard times, and it does really affect the whole family as well. So what do you find is probably the most common clientele that you deal with, like emotionally? What are they dealing with that you would like to, I guess, get out there and know, to let maybe other parents know, or even other professionals and practitioners know that this is normal, or they're not the only one experiencing this? What do you find, I guess, is the most common thing you have, parents coming to you for?
Sometimes it's hard to pick one thing because we do see such a range. I guess one of the things that we're particularly keen on doing at Glow is not just waiting until parents really feel that they're struggling, or are really starting to think, or their GP or maternal child health nurse is starting to think, look, I'm worried this mum might be depressed. We actually don't want people to wait that long.
Okay.
And I think the word is starting to get out, because we would see quite a number of people who are really dealing with a lot more of the, I would say, kind of normal adjustment to parenting. Because as you've mentioned, it really is one of the biggest adjustments, I think, to a couple, to go from being a couple to being a parent. And, even when we see people during pregnancy and you try to prepare people, you're a mum, I'm a mum. I think most mums would know it is really hard to be prepared no matter what people tell you.
Yeah, and I think that's also hard too, is that so many people want to tell you so many things, and this is what you should do, and this is how you should do it, and no, you're not doing it right, and do it this way and do it that way, and it becomes very overwhelming. I know myself, had, I'm going to be honest, I had definitely moments where I maybe felt like I was, a little bit depressed, and I did go to the doctor, and they were, they did like a little bit of a test, thing on me. They asked me a few questions and then handed me some antidepressants. But I went home and went, no, this is not what I don't want to take the drugs. I need to kind of work through this. But I wish I'd had someone like yourself to be able to talk to get maybe some skills or some techniques or something to help, rather than just for me to go to the doctor and for them to go, okay, yes, you're depressed, here's antidepressants. Do you find that that's a common thing as well?
Look, quite common. Quite common. So, antidepressants have their place, and in the right place, very good.
Sure.
But it's just one part of the overall approach. So, and because we encourage people to come along earlier, we do see a lot of people struggling with that adjustment, as you've mentioned, overwhelmed by conflicting advice, lots and lots of anxiety. That's something that is becoming more and more common over the last few years, and possibly even becoming more common now than depression.
Yes.
So we would see a lot of that. And certainly our approach, is to spend, you know, time with the mum or the dad, really understand what's going on. And with that real understanding of what the particular challenges are, what the stresses might be, and what that individual wants, then you've got a whole range of treatment options to consider. And one of the things we recognise at Glow is very much that you can't separate out your mind from your body. You know, we're in the one space, we're all connected, and what's happening in your mind affects your body, and what's happening in your body affects your mind. So we take that broad approach, and we'll consider things, you know, from kind of diet and nutrition, and is that affecting well-being, and can that be maximised? You know, exercise, the benefits of exercise, the importance particularly of things like yoga as an exercise that also incorporates a whole lot of mindfulness and sort of calming and slowing down practices. And then, you know, looking at, are there actually some practical things? It might be around getting some good quality breastfeeding advice, or some, you know, good quality sleep and settling advice that resonates, you know, with where a family's at and their philosophies. And once you put in all of those bits and pieces, we then might move on to something like psychological therapy. So some counselling, helping people just get some skills, maybe around stress management, or if they are starting to feel a bit anxious or a bit low, some strategies for improving their mood. And then, you know, moving down, if those things don't work or aren't enough, you know, that's when we would consider medication.
Sure.
So it's really having a broad approach.
Okay. What would you say to even maybe if a couple that are thinking of, they're starting to plan to have a baby, how could they benefit by coming to see you, to ensure, I guess, that would you probably encourage the mothers maybe more who have maybe possibly had depression or been diagnosed with depression in the past, that before they conceive to come and see you, where you can maybe work out a bit of a plan so that, you know, with all the hormones going on, that they don't kind of dive deep into the depression during the pregnancy? Is that something that you would recommend?
Definitely. That's one of our really big kind of messages out to our local community and GPs and women themselves, is that if someone has had a past history, and that might be around a previous pregnancy, they might have had postnatal depression or anxiety, or it might not be pregnancy related, it might just be that earlier in life they've had some struggles. Fantastic idea to come along before they conceive, just to talk through the options so that people do know what the options are, and very much about really empowering, you know, women and their husbands to know what they can do to stay well and to prevent problems happening, but then also to be aware that if symptoms do pop up, be aware of them and feel that they do have a plan for how they can respond and help manage those.
Okay. And could you maybe explain maybe what kind of symptoms, for even, you know, for the mothers watching, if they might feel like maybe they don't feel right, but then are they questioning themselves whether they need help? You know, what are the kind of obvious symptoms for them to kind of get a bit of an idea of going, okay, no, I do need to see someone?
Some help. So the two common lots of symptoms we have are the more depressive symptoms, and then also anxiety. So on the depression side, I mean, as you said, everyone has sort of up and down days, but particularly if women are finding that they're feeling quite sad and teary for no particular reason, and for the majority of the time, you know, we often say sort of more than half of the time, if it's becoming difficult to enjoy your usual activities, you know, whether that's seeing friends or a hobby that you have, if it's really becoming hard to enjoy those as much as you normally would.
Okay.
That can certainly be a sign. Difficulty switching off at night, difficulty sleeping. And then there can be a variety of other things as well, of feeling really quite lacking in energy, not motivated, you know, not interested in seeing people. But usually it's a combination of a few of those things. So any one of those things by itself might not be something to be too concerned about. But when there's a couple of them and they're lasting, you know, more than a week, because again, you know, something might happen, you might have a bad week at work or at home and you feel a bit low for a few days. But when it's lasting more than a week, I think it's worth touching base with someone.
Okay. And
the anxiety is also, because it's so common now. So I think if people are finding that they're feeling constantly worried and anxious and tense, and it's really difficult to control those worries, that's really another time that it is worth, you know, talking to someone so it can be further assessed.
Yeah. Okay. And do you help maybe women or couples that have maybe gone through maybe a traumatic birth experience? Because I mean, myself, you know, working with couples to help them prepare for their birth, you know, I've had couples, you know, maybe their second or third child come to see me, and they talk about how their birth experience has then led them into postnatal depression, and a lack of connection between them and their babies. Is this kind of a message as well that we need to kind of get out there, that if you feel that you have been affected by your birth, that it's important to talk about it rather than hold it in and draw it out, because it can affect you for years, and even the relationship between you and your baby. Do you see couples regarding that as well?
Absolutely. So that is quite a common thing, and it might be that might be the particular reason that couples or women have identified. Sometimes it comes up as one of the other, you know, contributing factors, but it is a big thing. And I think what's really important, from what I see, is that what is traumatic to one person might not be traumatic to another person.
Sure.
And I think sometimes women have, you know, might have a picture that a traumatic birth has to kind of be, you know, an emergency, kind of medically difficult. And if it's not to that extent, they sometimes wonder, you know, do I kind of have the right to feel that my birth was traumatic? But trauma can be anything from a labour that happens really quickly, so that there's not time to prepare. It might be the other extreme. It might be a labour that is really long and, you know, physically drawn out and exhausting. It might be about unexpected things happening, you know, intervention that wasn't planned. It can also be a common thing that I hear is that even when things kind of on paper, everything's turned out well, you do feel a sense of loss of control and loss of power and not knowing what's going on. You know, that can be very traumatic. And you're exactly right that if those things aren't dealt with, they can, you know, last for quite a long time.
Yeah. Okay. And you talk about too that it's not only just about the women, but even the family as well. So it's so great to hear that you even have a psychiatrist who is there for the dads as well. I guess what do you find with dads is, because I guess too there's this stereotype that, you know, the dad has to be the strong one and they're there to, you know, support the family. And do you have many men coming in to see you with I guess for me personally, it's not something that I've also thought about. I guess because you sometimes do feel like, oh, I'm the one that went through it. I carried this baby for 9 months. So this is definitely even opening my eyes up to, it's not just you who is affected by this event, this massive event, but it can be your partner, your other children as well.
We still have a lot more women coming in as the primary client than we do the dads, but the number of dads is growing, and that's one of our aims, is to get that growing even more. So I think there's growing awareness and evidence that dads are affected during pregnancy and after pregnancy, and so there's been some really good initiatives from organisations like Beyond Blue and also Panda, which have now got dedicated arms supporting dads.
Right.
So we know that if a mum has postnatal depression or anxiety, that actually puts her partner at increased risk of also having trouble.
Yeah.
And in fact, it's around about probably 1 in 20 dads during pregnancy, dads to be, I guess, during pregnancy, who might have emotional health problems, and about 1 in 10 dads afterwards.
Wow.
It's pretty common.
Wow, that's a lot more than what I would have ever thought.
Absolutely, and I think there's still, such issues with that kind of stereotype, as you've said, that the dad has to be the strong one. There's different challenges that dads face, that not always, but often they are the one who is still feeling like they're the breadwinner and having to perhaps financially support a family, adjust to the responsibility of feeling that they're now responsible for a baby as well. So we're definitely seeing more dads.
Yeah, okay. So do you have any tips or advice, if there are couples preparing for a baby, or even if they're pregnant or even post, do you have some tips if they're maybe unable to come and speak to someone like you? What can they do before, during and after to ensure that their mental health, they stay healthy, not even just positive, sorry, I probably shouldn't say that, but is there any advice that you can give them to help them prepare for this time?
Yeah, I think, one of the really important things is to start with the basics about, looking after yourself. And as parents or parents to be, we have to look after ourselves to then be in a good position to be able to help look after our partner or help look after our children. And even during pregnancy, mums need to look after themselves to give their growing baby the best start in life. And looking after themselves, it does go back to, sometimes it's really boring stuff, but it's as simple as, making sure that people sort of get adequate rest.
Yeah.
Doing things like, physical exercise is just so good for the mind and the body. So really taking care of themselves like that.
Yes.
Having some time to do whatever it is that they find is enjoyable and relaxing and lets them kind of decompress from the stress of the world.
Yeah.
Social connection is another really big one. So this idea of men and women finding their tribe and finding their supports.
Mm-hmm.
So ideally, other parents to be or family or friends who've got young children. So you've got a network of people who are in a similar stage.
Yeah.
And that would certainly be one of the things that I come across a lot as well, is that feeling of social isolation often in new parents.
Yeah. I think also, sorry to cut you off, but social judgment too. I think I've definitely found that when becoming a mum, you felt like everyone was comparing each other. Unfortunately, it's so unfortunate like that. I don't know if it's just me, but you went to a mother's group and there'd be baby's already on solids, and then, you know, mothers would be like, oh, you're not giving your baby solids yet. And then you start questioning yourself. And, you know, so I personally, and I know this even talking to a lot of friends, that is something too, yes, finding your social tribe, but it's going to be a positive one, that they're going to support you in what you're doing, not kind of question and put you down for maybe your decisions and what you're doing, because we are all different and we do all parent differently, and that's okay. But unfortunately, there seems to be these kind of, I don't know, competitive, I don't know what it is. Do you find that? I don't know.
Yeah, look, absolutely. You're certainly not the only one. I think that is a massive
it's hard.
Yeah, and so absolutely your tribe has to be the one where you feel comfortable and supported, and sometimes it does take a while to do that. I often prescribe for my patients, so to speak, is get off Facebook. One of the things that you know, whilst in some ways it can be useful, particularly for people who might be feeling socially isolated, they can get a sense of connection. But I really encourage people to think very carefully whether social media in particular is helping them or whether it's contributing to this sense of feeling judged, having to keep up with other people's standards. And I might be a bit behind the times, but I only recently came across this phrase of fake booking instead of face booking.
Oh,
and
yeah.
This idea that, you know, a lot of what gets put on Facebook is pretty fake.
Yeah.
You know, it's that one moment in the day when everything is looking pretty perfect.
The rest of the day is like...
The rest of the day is chaos and messy, because that's what parenting is. Yeah.
I think there is, you know, I did feel this as well. You know, there is, in some ways, I guess, through social media and people, again, just people wanting to tell you everything that you should be doing. And if you're not doing this, then, you know, and that, for me, I think personally, I mean, I had a really good tribe around me, but there were still those people that just, you know, even when it came to my pregnancy and what, you know, the birth that I was planning, not no one, but a lot of people judged me on the fact that I wanted to have a natural, calm birth with no drugs. They were shocked and, you know, no, don't be a hero, just go for the drugs. Like I was trying to be, some kind of hero for that fact. But I stood but I shouldn't have to stand my ground because this is my experience. But it is very hard to kind of put those people out of the picture, but sometimes you do, and maybe be selective about who you talk to and what you're going to talk to about. If you know that a certain person has an opinion about everything, then maybe steer clear from that person and don't talk to them about what you're doing, because you know that they're always going to come back with something. That's what I definitely learned, and something I definitely want to pass on to new mums is that you know the people in your life who are going to be supportive and loving towards you. And there are, unfortunately, and these people still love us, but there are some people who can be very opinionated, and that's where be selective about who you talk to what about. So.
Yeah, and just because someone has their opinion doesn't mean that you have to take it on board or do it. And it is one of these strange things, isn't it, that it still seems to be when we become pregnant or people feel they can tell us things or comment that would never happen at other times.
No.
So, I mean, it's a real challenge, and a real challenge for people who might have, you know, some difficulty being assertive or, you know, feel particularly sensitive to other people's opinions.
Yeah.
So, you know, making women feel that it's okay to say no or not listen to everyone else is very important.
Yeah, well, it sounds like that all women in Melbourne should come to the Glow Tribe. That sounds like the tribe I want to be a part of. But, well, I just want to, first of all, thank you so much for your time. I know it's getting late in the afternoon. I know you've been working all day, but how can people work with you? How can they come and see you? Do you only offer services in Melbourne? Do you offer online services? Please tell us, where can they find you and to be able to work with you and all the other amazing practitioners that you have at Glow?
That's right, part of our team. Unfortunately, at this stage, we are only in Berwick. We would love in the future to be in other places, but we have to learn how to walk first before we can expand. So we do only work in Berwick at the moment from our clinic.
Okay.
But we are willing to see whoever wants to come here. And certainly there might be a lot of people listening who aren't that familiar with the geography of Melbourne. We're sort of on the outer southeastern suburbs. And if you move further east, you start heading down into Gippsland, where there's not really that many services. So we've already had a number of people who are travelling a couple of hours from Gippsland to come in and see us because there is nothing else around. So we do have people travel from around Melbourne, so we don't mind where you live.
Okay.
For some of our services like psychiatry, psychology and paediatrician, people do need a referral from their GP.
Okay.
A lot of other services, physio, yoga, Pilates, nutrition, you don't need a referral. So women can ring up. Good place to find info is checking out our website, which is glowclinic.com.au, checking out Facebook, which is our long name, Glow Perinatal Emotional Health and Wellbeing Clinic, and also Instagram. So any of those avenues, and Instagram is glow_clinic. That will have links, that has our phone number. We have an online inquiry form so people can send their questions online. I think that pretty much covers how they can contact us.
Well, thank you so much, and thank you for being a member of Nurture Hub. And again, just let's get all this information out there to the public and let them know that there are these beautiful services, support, professionals who, if we all come together, just like what you've done, bring such a beautiful, array of different practitioners who can help from all different, like from preconception, that's the word I'm looking for, preconception, pregnancy, and, post-birth and early childhood. It's amazing. I think it's amazing what you're doing, and I really hope that you get up walking quickly and you can start expanding this, because I think there needs to be places like this all over Australia. So Lucinda, thank you very much for your time, and if anyone is looking for a practitioner near them, please go to our website, which is NurtureHub.com.au. We have over 2,000 listings of professionals, practitioners, businesses, products, service from all around Australia, and this is why I wanted to create this beautiful website, is to meet people like yourself, Lucinda, and to be able to really support each other in supporting women and couples and families and helping to grow healthy families. So thank you so much for your time, and until next time, we'll see you later.
And congratulations as well to you and Nurture Hub for your vision and creating this kind of nationwide community, because the more we do together to get the message out, the better for our mums, our dads and our babies and their future.
Thank you. Thanks so much, Lucinda.
Bye. Bye.